Sure, I'm an assistant professor of economics at the University of Dhaka, research director at SUNIM, and I'm finishing my PhD at the University of Manchester. Welcome you all to this session. So the session it's called Investing in Future, Education, Healthcare, and Child Protection for a Resilient Bangladesh. When Bangladesh started its journey in 1971, Bangladesh was dubbed as a limitless basket, a bottomless basket. So basically, we were considered as a failed case or something like that. So in the past 5.5 decades, Bangladesh made remarkable progress in many aspects. Like our gender parity in education, it has improved. Our child mortality rate has declined. We have also made some improvement in our infrastructure. But we have to ask ourselves the question, is this development enough? Till now, if the child who are born in the rural areas, they have 50% more chance to die before they age 5 compared to the child who are born in Dhaka. A child who, a girl who is from poor family background has 6 times more probability to be married off before her 18th birthday compared to her same cohort in the wealthier families. And also, you see, Bangladesh has been investing only 1.5% of its GDP on education and only less than 1% in healthcare. So with all this, we aspire to make our country a developed country by 2041. We dream of a highly developed country. But the question is, with this state of expenditure or investment in education, in healthcare, with this background context where we have high level of child marriage, where we have many other issues, including the disparity in healthcare system and education system, what we need to do to march forward? So that is the backdrop of today's discussion. It sounds boring, I understand. It's the last session of the conference. It's a day-long conference. I will try, and I have very high confidence with my panelists. We'll try to keep you awake. So today I have 3 distinguished panelists. I'm honored to have with me Professor Shafin Nahin Shimul. Professor Shimul is a professor of economics at the Institute of Health Economics at the University of Dhaka. He did his PhD from the University of Nebraska-Lincoln. We have Dr. Ruwaya Murshid. Ruwaya did her PhD in the University of Cambridge. She works fantastic works on education and child protection. And we have Ms. Tashmina Rahman. Tashmina, she did her master's in economics from the University of Dhaka. She have a master's in development studies from the University of Manchester. So can I have a clap for my panelists? Please come on stage. We can follow the pictures, right? I think we are fine with the photos. Thank you so much. So, as I was saying, it's the last session. We have 90 minutes in total. How we will be dividing the time is, for the first 45, 50 minutes, we'll have 2 rounds of discussions in the panel. Then we'll have 25 minutes of open discussion. I will take the questions from you. And then in the last 10 minutes, we will be responding to your questions and make some concluding remarks. So I would like to start with my colleague from the University of Dhaka, Professor Shimul. My first question is regarding if you see the development of Bangladesh and other countries. Bangladesh started at a similar stage of development with other countries like Singapore, Hong Kong, not Hong Kong, Singapore, Thailand, South Korea, Vietnam. So we all had this kind of similar story. Like we all had this almost kind of similar per capita GDP. But what happened in the early 1970s? They started to develop their human capital. They started to invest more on infrastructure, in education, in healthcare, yeah, and drop more private investment. So what happened over the time? All these countries, they have built in a world-class healthcare system in their countries. For instance, right now in Malaysia, for every 1,000 persons, there are 4 hospital beds. So for say 10,000 persons, there will be 42 hospital beds. In Bangladesh, we have for 10,000 people, we have only 8 beds. So you see the level of disparity that has widened over the time. My question to Professor Shimul is, why do you think, like, where we were not able to make the progresses? What were our main challenges? Is it the corruption, the institutional challenges, or the lack of motivation from the leaders? And what could be done?
Okay, thank you. Yeah, I think you have a very good opening. So we already mentioned that we progressed. I mean, let's start with a positive thing. Bangladesh has done very good in immunization coverage. It's higher than many developed countries, so it's not necessarily bad. Our child mortality has declined significantly. Infant mortality also declined significantly. And if you think about family planning, there's probably Bangladesh is kind of touted as one of the best cases for success. And if you look at see some connections, I mean, difficult to say the causation, but if you think about the correlations among these things, all 3 success I mentioned has one similar characteristics. One is we had a donor funding, continuous funding, and we had government was very much involved, interested. So I would say the more leadership, willing power was very much kind of involved. And third, most importantly, social mobilization was significant there. And NGOs and others did a very good job on that. So all these 3 success stories has this kind of similar pattern. The things we failed, where we failed, you'll see at least one of this is missing. So, and then funding coming from international agencies sometimes comes with conditions. You have to have reporting format, you have to follow all this transparency, accountability, that kind of reduce some level of corruption significantly. So proper utilization of resources is kind of guaranteed, your target is clear, and you have social mobilization. So this is kind of, let's start with a positive note. And the things we are now struggling that compared to many countries Mahatma mentioned, when South Korea started their universal health coverage, it was around late 1960s, and their per capita GDP was less than ours. So that's doable. I mean, the problem was if you look at all of the big reforms in healthcare happen around the world, it come with a big vision from a leader. So that's why we call it, in UK we call Beveridge model, in Germany we call Bismarck model. We call by name. In US we call Obamacare. In Korea we call Moon Care. So there's a visionary leader behind the scene. Now, there's difficult to find a causal relationship. How can you find a good leader? Definitely there's this demand from that inside that people have a demand that kind of help to get this sort of leadership. So that did not happen in Bangladesh. We know that. And even in recent time in India, they have focused on health. And many of us here and economists, we know that why you do care about health. I mean, if you don't have a good health, you cannot have good education. Our panelists are an expert on that. So on all other human capital will be affected. So you have done good education, your productivity will suffer, which will ultimately affect your GDP. So our focus was not there. So that's the kind of thing I would say significantly missing in the last couple of years, or maybe since independence. Now, what are the key challenges we are facing? Let's focus on that first. We have a financing issues, and we know that our GDP, like expenditure on health, as per GDP, is less than 1%. And it is probably only two, three countries in the world that falls in this category. One is Afghanistan. So, I mean, even if you look at the all war-torn countries, even Sudan, like South Sudan and others, their per capita health expenditure on the GDP is higher than us. So this is really embarrassing. And that's the financing side. And also, what is the implication? We have 70% out-of-pocket expenditure. You know that since economics, that when you take healthcare, we pay 70% of the total cost out of pocket. And what is why it's a problem? It's a problem because then it becomes catastrophic. You become poor. And there's a WHO study that found that due to these expenses, almost 5 million people fall into poverty again. So we have a lot of effort on poverty reduction, but there's other loopholes. Because of these health expenses, people are becoming poor. We have limited attention on that. Very weak public health care. Some people will say, no, that's not true, because we have a good infrastructure in terms of community clinic. That means only 6,000. We have a clinic for every 6,000 people. It is not even available in US, in many developed countries. Then why you are saying that poor public health care? The problem is we have a structure. We focus too much on structure. Healthcare, we mean a building, a doctor, and some medical colleges. That's the healthcare. But the primary healthcare is lot more about that. So if you go to, I just came from Bhola yesterday, and Bhola I saw, it's just 10 minutes from the Shodor, Upajala, and it's difficult to get people that service in primary healthcare. So these are the kind of, we didn't focus on that. We focused too much on structure. And then skilled workforce. That's another big challenge. So we have again, the thing I just mentioned, we have focused too much on producing doctors. But medical care is not all about just doctors. We need technologists. You'll find in many hospitals, there is no one there's technologists who can do the diagnostics, who can perform the X-ray. So unless you have this input mix correct, you cannot actually get the output, because government took a decision to give an ambulance in each hospital. There's a good example is given, and they're given an ambulance in a hospital. They don't have a road connections, because government so government is focusing more on purchase, buildings, purchases, procurement, and we know why. So these are the high NCDs. Bangladesh is becoming a sort of hotspot of NCDs because back days we did very good on reducing communicable disease, again with the help of the 3 factors I mentioned. But for NCDs, we are not focusing much, and all of these things creating a huge issue for us. One thing also I want to mention is corruption. It's kind of obvious. Now, the corruption is everywhere. It's not that there is no corruption-free country, and particularly we are not more corrupt. There is no way to think that. I can give you one example that may not be very much connected to this, but it could be useful. I just visited Doha on my way back from US to Bangladesh just 4 weeks ago. And in Doha, there is almost 84% people are from Bangladesh, India, and Pakistan, and the rest are like Qataris. And Qatar is one of the safest nations in the world. So we genetically not corrupt. There is no way to think about that. That's wrong, totally wrong. So our system makes us corrupt. And now what we did, what we kind of failed in corruption, is we always care about punitive measures. We don't have a preventive measures. Think about this Balish Kando, you remember. Well, how do you know? Because there is an DPP, people looked at that and they figured out that cost is too high. So keep it open. Things are not open. I can share one example. I work on a research project, and we went to a government He was a director of admin, and I talked to them that your website does not include how many human resources you have, and we need this information. And the thing he said, send me a prayer, not application. There's a huge difference. Very, I would say, objectionable word. So submit a prayer. We'll see whether we can give you the data. But this should be open. It should be public. You are using public money. Everything has to be very transparent, and we don't have it. So think about like equipment purchasing. When you purchase an equipment, you should have all specification, everything in the website so that someone can challenge. You are buying a equipment of 2010 model at the price of 2020 model. Why? So these are the things is not working. I think I'm gonna have. I should. Okay, back up. So broadly speaking, these are the four or five areas I mentioned. Financing is an issue. Weak primary health care. We don't have a skill mix, and high prevalence NCDs, and finally corruption. So these are the challenges. I think if we had time, we'll talk more. Thank you.
Thank you, Professor Shimal, for all your remarks, and within the short 7-8 minutes, you have covered so many areas. So now I would like to move to Dr. Rubaya. So, Dr. Rubaya, you know that Bangladesh, it has been argued that Bangladesh made many good progresses on the education sector, but the picture is not that rosy, actually. So we have still one of the highest dropout rates when you consider the secondary school education, 37% dropout rates in the secondary education, 18 or 20% in the primary education. The school teachers in Bangladesh, they are one of the lowest skilled trained teachers in the world. If you talk about the learning, almost 65% of the children in the grade 5, they don't know the grade 2 level of calculations or reading skills. So you see, all those issues are there, and also there is another issue is all the good education institutes that you see, those are mostly actually in the urban or peri-urban areas, like in Dhaka or Chattogram. But if you just go to Bandarban, Khagrachari, there's a huge difference in the quality of education. So we have the disparity of education across regions and also across institutions, the English medium, the madrasa, the Bengali medium. So my question to you is, why haven't we been able to ensure an equal and quality education for all after these 5.5 decades of independence? Is it poor governance, lack of accountability, or weak policy education? Or what challenges do you foresee in the future, and what reforms are needed? It's a big question, but 8 minutes, please. Thank you.
Thank you, Matape. So yeah, yes, it is a big question, but I think that despite what the statistics say, that we have been doing well, we have good enrollment rates. At the secondary level, girls are going to school more, but I think the problem across all the problems is at the root of what do we actually expect from an education. So in my PhD work, this question kept coming up. So I worked on returns to education, which is a very economics of education field. We look at so the idea is the more educated that we are, the more we will earn, right? So the job market signaling model says that, human capital theory says that. So that's one part of it. And that has actually shaped our whole education system and our outlook towards education from pre-primary up to university. How? I'll tell you. It's lekha pora kore je gari ghora chore she. From the get-go, we have these levels that, okay, grade 5 students should be learning at grade 5. And when they don't, what happens? What is actually happening? So you're meant to be able to do some multiplications in grade 2. You're not being able to do that, but you go to grade 3, and this carries on. Because there is a problem at the root, because I don't think we're all aligned in terms of what we want from an education. And when I say all, I mean teachers, policymakers, politicians, students, the general people. We're aligned in terms of that we want an education to lead to the job market, but because it doesn't go deeper to the root, today, if somebody, even from this audience, asks me, you're talking about returns to education, going to university and earning money, but I can drop out of college, become an influencer, earn more than you are earning as a lecturer. That's true. There are people who are earning more than me, and with half my education. So there's something there that if we're framing education to be a pathway to the job market, to the labor market, and we're assessing students at every level that, okay, they're a good student because they have a good CGPA, their learning level is high. If we don't go deeper into the nuances, at the earlier levels, it's standardized. So across the world, at grade 1, 2, 3, 4, we have standardized measures of, okay, a grade 2 student should learn these things. At that level, the problem is why aren't our students learning at that level? It's because our teachers, like you mentioned that they're not skilled. They're not paid. They're not motivated. There was a big study in Indonesia where, keeping everything else constant, they just gave an increased salary to teachers. And they tried to see whether teachers perform better in the classroom and the students actually perform better. It didn't work. If you give me twice the salary that I'm getting today, I can't promise you that I'll perform better in the class if I'm not motivated to go and teach my students in a better way, or if I'm not motivated to translate my teaching into better outcomes for my students. There's a human part there. There's a human part of human capital that we forget. At earlier levels, it's a problem of there's a cycle. There are teachers, there's infrastructure, there's pedagogy, there's curriculum, there's content, and there's a misalignment there. And we can't deliver, and there's inequality there. A student from Dhaka versus a student from a rural area, a girl versus a boy. When we talk about learning levels not being to the mark, are we thinking about everybody? Are we thinking about when we want them to learn? Are we giving everybody the same provisions to learn? At the lower level, that's the case. I think that's the problem, that we're not thinking about what we actually want from our students, and for them to be able to achieve that level, are we giving everybody the same resources? Especially, are we giving the teachers that same ground to perform in the class so that students learn? The higher up we go, I think it's a problem of the narrative. If we're going for returns to education, if we're going for a labor market outcome perspective, I feel like we're going to continue to... somebody just yawned, sorry for boring you. But my point is, if we keep on following this labor market-oriented perspective, we're going to stumble even more, because someday the next generation, today even they can say it, we don't need education. We can go directly to the job market, we can go to YouTube, we can go and learn the things that you want to teach us, and we can earn money. If earning money is the goal, then we don't need the education. That's why it's very crucial at this point, at this juncture, for us to reframe the purpose of education, which is where the second part of my work from my PhD comes in. It's a lot of economists now are arguing that we need to take a step back and focus on non-labor market outcomes of education, the human part of it, how kind we are, how politically engaged we are, how civically engaged we are. Say I have a degree, I'm very educated, but I don't think twice before taking a bribe. In the eyes of the narrative, I'm still educated, right? That's what we need to change. That's what we need to challenge. That's where I feel the change lies for Bangladesh. We can follow all the Western models, all the models out there, but when it comes to our own country, a decolonized, contextualized view of what we understand by education is very important, because once we fix that, determine that, that's when we can start to design our education system in a way that suits us and can take care of the inequality across madrasas, across English medium, general medium. When we talk about inequality across these mediums, Mathabhay, it's interesting, because do we mean the education provided across these streams? Do we mean that a student from the madrasa, a graduate from madrasas versus a graduate from general medium, do they differ? Evidence, we don't have evidence for that. And that goes back to, we need to do research in these areas to see, okay, if you go back to the school choice problem, when a parent sends a child to a madrasa versus an English medium, there are particular decisions they make, there are particular criteria that they follow there. There's selection bias there as well. But they go through different educations which has similarities, which has disparities as well. But I have a PhD paper where I show that this narrative of quality, is it differing across madrasas and general education? I don't have English medium data. But it says that students from madrasas, they are more likely to earn the same as graduates from the general stream, but they're less likely to become employed. So is it a matter of skill? We don't know the black box there. Is it because their aspirations vary? Is it a discrimination story? Is it because there are differences in job network availability? And that goes for urban-rural disparities, disparities across girls and boys, across different streams of education. So I think there are a lot of similarities there, but at the root, it's very important for us to step back and decide, what do we mean by an educated person? What do we want from an education? And then align that at different levels of education. So that's my initial reaction to your question.
Thank you so much, Rubaya.
Thank you.
So, is it working? Yeah. Thank you so much, Rubaya. So insightful. Particularly when you mentioned that the purpose of education, it's the human part of it. Like, it will tell you, it will make you aware that you are a human being before anything else. So, so I think I agree with you completely. So now I move to Tashmina Appa. So you are a senior education specialist at the World Bank. You have been working with the World Bank for so long, and particularly on the education sector, you have seen the perspective and projects that the World Bank do in many South Asian countries and others. So when you compare Bangladesh's education sector with other South Asian countries, like what are our key achievements and shortcomings that you see? And followed by what evidence-based successful interventions can Bangladesh take to improve our children's education outcome or improve our education sector? Thank you.
Thank you, Mahtab, and good evening to everyone. So when the indicator that I personally like to look at recently is the learning poverty indicator. And for those who are not familiar with learning poverty, it measures the share of students who are able to read and understand a simple text by the end of primary education. And personally, I think it's a great indicator because reading is actually the foundation for building skills for other pathways. So if a child is able to read and understand, they have a very strong foundation to gain other skills. So when we look at Bangladesh in comparison to South Asia region or in the global context, we see that it's not doing that bad. If we look at the glass half full, well, Bangladesh has 50% of children who can read and understand a simple text by the age of 10, whereas in South Asia, it's 57%, that's the average, and globally, it's 60%. So we have had good achievements in education. I think the panelists before have spoken about it. Bangladesh has already achieved gender parity in basic education, near universal enrollments in basic education, but still a long way to go. Access is still issues, especially when considering certain geographic locations, certain communities. Access is still an issue that we have to address, that last mile issue of out-of-school children. And that hasn't been in our formal domain as much. More importantly, I think the fact that 1 out of 2 children by the age of 10 can only read and understand a simple text, it's not a result that we should be satisfied with, although maybe we're doing better than expected than other countries in the region. And a large part of the reason why we haven't been able to achieve better results is because of the quality of our education system. And I guess that's no surprise to all of us who are sitting here. And when we looked at some of the reasons, particularly for Bangladesh, where we're lagging behind in quality of education, first and foremost is what children are receiving at the very early stages of life. The first 1,000 days are the most important, whether the child is receiving the nutrition and stimulation from their parents as needed. Then there's the aspect of readiness for schools, and for that, pre-primary education is very important. You know, when we talk about the Bangladesh success story, we talk about access to primary education, almost near universal rates. But when we look at pre-primary education, we haven't, done that well. And so ensuring that children receive access to quality pre-primary education and have those early year cognitive development is extremely crucial. Second, in classrooms, we have a shortage of qualified teachers. So teachers who have the content knowledge and the pedagogical skills, as well as access to pre-service training. We do not have pre-service training for our teachers, so we are sending them unequipped into the classroom. We do not have structured examinations where formative assessments support student learning and have a good connect with the summative assessments. We are yet to have mini systems in place where all these assessment results come in and schools, teachers, head teachers, parents are informed of how their children are doing at the school level, among school levels, at the district divisional levels, at the national levels. We are yet to make or leverage more of that data. The data is there, but it's not properly utilized to inform policies and operations. And last but not least, which in my opinion may not be the biggest challenge, is inputs, right? The physical infrastructures, classrooms, access to wash facilities, safe drinking water. Those are still, especially with how we've expanded, those are still issues where we are struggling with. Now, one of the things that Mahtab you asked is that what can we do? Now, as a practitioner in this sector, I at times feel overwhelmed by the sheer fact when I look at our primary education system. 65,000 government primary schools, 20 million students. It's a huge demand, right? But then we don't have as much funds that we would like, or to support them. So what are the areas that we can effectively intervene into to make a dent? Now, we did not have much research in what really works in low and middle income countries. But in the past year or so, we've been able to gather from over 10,000 studies what actually works. What are some cost-effective interventions in low and middle income countries that countries like Bangladesh can take up, given that we have fund constraints, given that we are still at a very developing stage of our education system, I would say. So when we look at that, and this is actually published, it's the Best Buys report, and it was undertaken with the Global Education Evidence Advisory Panel, and in collaboration between the World Bank, UNICEF, UNESCO, and USAID. And in that report, they looked at all of these studies and interventions that have done well. And for Bangladesh, I would have to come and say 3 areas where we can really focus on. The first is structured pedagogy for teachers. So when we give teachers, like in our case, where they don't have pre-service training, they may receive 1 or 2 times training in their lifetime of being a teacher in a primary government school. They really benefit from structured lesson plans, lessons on reading materials and learning materials, and then teacher support, that all kind of align the way teaching process takes place in the classrooms. And this has been found to be very effective when scaled up in countries such as South Africa and as well as Kenya. So this is one area that I think that we should actually look into in Bangladesh, since we have teachers who are lagging behind in terms of the skills that we are able to equip them with. The second area I would say that that has shown really great promises in contexts like ours is teaching at the right level. So teaching at the right level is where students are taught by teachers at their level of learning instead of their grade or age. And this has been found to be very effective for students who are lagging behind, especially after cases such as the post-COVID case where schools were closed for 18 months. And then I would say even post-pandemic, Bangladesh's education system, schools, we did an analysis where we saw the number of days that schools have been closed in the past year. It started with cold waves, heat waves, July-August movements, flooding, again, closures for various elections. The context hour has been very low. So automatically, parents who are educated, have the money, they can afford to have tutors, at home to help those students recover, to help their children recover or continue learning. And then there are parents who are not able to afford these resources through their kids. So when schools open and they come into the school, some kids will be lagging behind than other kids. And for a teacher, that means they are dealing with a lot of learning inequities. So teaching at the right level is that model that has been used in countries like ours, and it's been found with rigorous evidence to have worked in countries like India as well as Ghana. The last area where I'm personally very passionate about is parents-focused early stimulation for children aged 0 to 3 years old, and then high-quality ECE, early childhood education programs for children aged 3 to 5 years old. One good thing is that in Bangladesh, over the couple of past years, we have been providing government-provided pre-primary education for 1 year. And very recently, the government has piloted an additional year targeting 4 years old, and there's plan to expand on this. And we found that in Bangladesh in particular, kids who have received 1 year of pre-primary education are 37 percentage points more likely than a child who has not attended an ECE program to be developmentally on track, holding all other factors constant. So what we see is that ECE programs and where parents are involved and they can provide that home environment and stimulus, that really helps children make headway. So I would really think that, given all of our circumstances, we really need to look into what are the low-hanging fruits, cost-effective, that we can, in our context, really invest in and help our system to do better. And as I think Rubaya said very nicely that about the human nature of looking into education and the views as well. I'm not going to go into the higher education perspective. I'll focus on foundational learning. But yes, Rubaya, just to compliment on your work, we've also found that there's a large number of educated graduates who are unemployed 1 to 2 years after their graduation. And I think it's after everything that has happened, it's now very critical that we put ensuring healthy children, ensuring kids have access to good jobs and are able to contribute economically and feel as productive citizens. That should be at the center and forefront of everything we do. So I'll stop here. Thank you.
Thank you so much, Tasmiyappa. That was so insightful, and particularly, I would like to go on with your finishing line, that we have a large pool of graduates who remain unemployed for a very long period of time. There is one study by the ILO who showed that it takes almost 60 months for our graduates to grab a job, and a recent World Bank study or report from 2022 that shows that only 10% of our university graduates they are employable in the job market. So I want to come back to you again, then Rubaya and Shimul Bhai again. So my question to you is that now we're living in an age where you can wake up in Japan but work for Jamaica. You can replace Claudia with Claude. So it's an age of AI. So you can almost do many tasks with AI. So in this changing dynamics of the 21st century, you see our education sector, as Selim sir was saying in the last session, that our policies remaining still in the primitive age. Our education sector is still, our curriculum that we are talking about, it's quite backdated. At least what is taught by our national curriculum. So what structural reforms are necessary to bridge the gap between education and employment or the demands of the 21st century? And how can partnerships between the government, NGOs, and international organizations drive sustainable change in this sector?
So you want me to continue?
Yes.
Okay, I'll keep it short. Thank you, Mahtab.
You'll have 7-8 minutes again. So.
No, thank you, Mahtab, because you pointed out on something that I couldn't cover and I had alluded to is the graduate tracer studies. So this was, in the recent years, we've done graduate tracer studies, and we actually found that almost half of all tertiary graduates, whether you're from university-affiliated colleges or from the TVET sector, only half of them are employed 1 to 2 years after graduating. University students tend to do better. Then it's actually TVET students, and then it's those coming from the affiliated college sector. as I had mentioned, that at the heart of everything, I think we should now look at good employment opportunities for our children and to make sure that they feel they are productive citizens of the economy. And for this, it's extremely critical, as you mentioned, Mahtab, for education systems to now work closely with the industry and private sector. One of the reasons is that we see our higher education institutions, they are not getting the funds that are required as compared if you look at developed countries for research and development. And when we don't have investments in research and development, where we're not allowing, where we're not giving opportunities to our teachers, to our students at universities to get engaged in R&D and to collaborate with the industry, we are losing out. One is that there's not a knowledge transfer. So a lot of the things that are now being adopted in industries, that remains with them. So when our graduates go out, there's of course a skills mismatch and it takes some time to catch up. Research and innovation with the industries can help reduce that gap. And we actually need a framework for this type of collaboration. So academia-industry collaboration is extremely important and it's still at a nascent stage, I would say, in our country. So I really hope that we can work towards a framework and encourage this, more academia and industry collaboration. This also is important because when industry comes in and works with academia, it also brings resources. So that can actually help with some of the funding issues that we see in higher education or more tertiary education in general. The second area that I think it's important is for us to consider quality assurance systems. So the quality assurance system is important because I personally feel that Bangladesh does not have a culture in some institutions of giving feedback. Feedback from students, feedback from teachers on what's working on their program, what's not working, what we can do differently, what we can do better. And then to ensure that that's being evaluated at the department levels, at the university levels, externally. And then allowing for revisions and change, allowing for industries or employers to come in with their feedback on curricula. And quality assurance systems, well, they started in Bangladesh. There's the Bangladesh Accreditation Council that was established. There's still much more to do, and I personally believe that if we can shift that and are more open to these mechanisms, they can help. And last but not least, I would also focus on national qualification frameworks. We mentioned, right, we touch upon the different streams, even in higher education, where there are 3 streams that I talked about: universities, affiliated colleges, and TVET system. So the Bangladesh qualifications framework was developed building on the higher education quality framework and on the vocational education framework. And it was developed exactly to reduce these disparities and provide employers with one set of unified qualification for students, regardless of whether he or she is from university affiliated colleges or from the vocational education. It allows for horizontal and vertical movements. And it's a huge reform, it's a huge area, and a lot of resources and technical know-hows are required in its implementation. But I believe that a step towards it can actually improve and allow for more opportunities, allow for more signaling to the market, and actually ensure more quality assurances in our systems. So I'll stop here.
Yeah.
Thank you.
Thank you so much, Tashmira. So when I look at the crowd, I see you are pretty tired. Some of are yawning, some of might be sleeping behind. But yes, that's all right. So we'll try to keep you awake. So most of you, I can see most of you are the students here. So and you are going to be in the job market in the next, if you are not already, in the next couple of years, right? So what do you think that how much time will it take for you to grab a job? How many of you are confident that you'll grab a job before you pass out, you get your master's result? Raise your hand. Okay. And how many of you are confident that you'll grab a job within a year of your graduation? Yep. Any kind of job. You can do freelancing as well. Okay. Good. And wow. That's so. Most of you will be, self-employed or something, or You want to start your own business?
BCS কয়জন? BCS কারা দিতে চায়? Who wants to go for BCS?
You can raise your hand. We won't deduct your marks, okay? So, okay.
Who wants to go into academia, into research and teaching?
Our discussion has not finished yet, but you can say, yeah, what? It's all right.
Sir, I want to do BCS. What do you mean by this? Does it count the fact that I don't want to do BCS, but since I'm in Bangladesh, I have no other choice?
যদি একটু বাংলায় বলো বুঝায় তাহলে খুব ভালো হয়, হ্যাঁ।
আচ্ছা, এখন আমি মানে বিসিএস করতে চাই কি না, এখন এখানে এক্স্যাক্টলি কি কাউন্ট করে? এখন ধরেন আমি বিসিএস করতে চাই না, কিন্তু আমি তো বাংলাদেশে থাকি, সুতরাং আমার কোনো চয়েস নাই, এখন ওইটাও কি কাউন্ট করে?
Very good question. So the question is, we have a very narrow job market. Yes. We'll come to that point. So the thing is, the country where, in Bangladesh, when you opt out when you are graduated, the amount of job that you see available for you is very limited. Why? Because our manufacturing sector, or our, the formal sector, it has not developed properly in the last couple of decades. We don't have, our 88% of our jobs are in the informal sector. Only 12 to 15% of our jobs are in the formal sector. Formal sector, how we define it? The sectors that have job contracts and all the other things. So why it didn't happen? It all are related to the sessions that you have seen throughout the day. It is related to the FDI. It is related to the private investment and more trade. So I hope you're more awake a bit now. So that was a trick to make you awake from your sleep. So I will come back to Rubaya now. Rubaya, my question to you is that you have been working on the disadvantaged children for so long, and I know you already published a book on that as well. Nobody's Children, if I remember correctly. And just to add, so in Bangladesh, we have so many children who are missing in education. That's one thing. And there are so many children who are missing out due to child marriage. So as I was saying, child marriage is a very prevalent thing in Bangladesh. 51% of our children, they get married before they turn 18. It is the highest in South Asia, one of the highest in the world. The speaker is working, it's not working anymore. It's all right. It's not my fault. So, okay, can you hear me? Okay, it's working, I guess, right? Okay, I don't have to shout anyway. So the thing I was saying is that, so you see, the child marriage, as we're saying, why 18? The number is, we say, it's underreported, because lots of the girls, they get married, they show on paper that they have turned 18, but they are actually 16 or 15 or something like that. The reason the question that I want to ask, Rubaya, is that this has been, children missing in education, the street children, they are not getting nobody has a headache about it. Like, we have never heard any policymaker saying anything about the children that you say who work in the tempu, or who work in the streets, or who are selling flowers in Dhaka University. No one has ever spoken, no policymakers has ever spoken about this, children missing in education, number one. And the second point is regarding this child marriage. No policymakers, we haven't heard from them any step to say, we can, stop this. So why do you think, what is missing there? I mean, why there's it is not coming in the head of our policymakers, and how can we, move forward from here? Rubaya, to you.
Thank you, Mahatab Bhai. I'll answer your questions first, but I do want to come back to the university and the BCS thing a bit. In terms of missing children, in terms of nobody's children, I do agree. They are not on the radar when we have our conversations, when we have these discussions, and that's very sad. When I wrote that book, it was from my experiences with some homeless children that I met when I was studying at the University of Dhaka. And they became like my second family, and I realized they opened my eyes to how privileged I am. how privileged each of us are to be sitting here, either on that side or on this side, talking about these underprivileged children out there. It's because of power dynamics, I guess. One thing is, these children, child labor is a big factor, and it goes back to socioeconomic backgrounds. If any of you have ever actually talked to a child who's homeless or who doesn't have parents, who doesn't have a place to stay, who's by definition underprivileged, not as privileged as we are. They don't get access to school, they don't have a place to stay, they don't have any guardians, they don't have their childhood. If you ever talk to them, you'll see that the issue there is they're just born into adulthood. They don't have their childhood because of socioeconomic disparities, right? The problem is, who is responsible for these nobody's children? Is the state responsible? Are we responsible as fellow citizens? Are their parents responsible? What if their parents struggled, they're not alive, or they're socioeconomically struggling? It's a very interconnected cycle of so many problems, but I do not know why this is not a top priority on our agenda. And the answer is there because they're invisible. And that is where I believe our duty as economists, as social scientists, as people who are privileged, is to make them visible, to bring them into the conversations. Like Matapay today has asked me the question, thank you for that, Matapay, that it's not a very economic issue, even though it is. It doesn't come into our discussions, but it is so important to bring them into our discussions, because at the end of the day, whether we publish in a big journal or not, whatever we do, what PhD we do, if we can't give back to the people through our work, I don't feel like that's a work well done or a life well lived. So in terms of that, in terms of bringing this issue onto policymakers' radars, I think it's as simple as being vocal about it, writing about it, voicing it, bringing these issues, these children who are not children, who've lost their childhoods, into a discussion. Next year, Sanim can bring 2 homeless children to this stage, sit them here, and ask them, what do you think about this country you're living? How is your life going? I was at a conference in Cambridge once, I remember. They actually brought school children out into the discussion on education. And the children said, thank you for bringing us. You talk about education. We're the students. Nobody asks us. And so that brings me to the second case. I know it's not part of your question, but I do want to talk about it, and it's from my experience in the classroom being a teacher. It goes back to what Apple was saying about the graduate tracer study and unemployment. You and I are both, we are all faculty at the Dhaka University, and one thing I will say, especially in light of the AI thing that you said, I know there is a lack of jobs in the job market and there's a mismatch there, but my take on it is that mismatch part of how we're training our students for the labor market. I think there's a gap there, and I think AI is going to awaken us to that even more. For example, meritocracy. Meritocracy is a system where we judge whether you're a good student or not, whether you'll get into university or not. And I have an issue with how we're judging that. How are we designing our admission tests to bring in students? How are we judging students? How are we assessing them? How are we saying, okay, you are better than them or her, him? I have an issue with that, and I often feel that our assessment system, even though we thrive on the concept of meritocracy, we actually have a very factory-based system. Our students go in, we give them this training, they go out. But there's a difference between an education and a training. There are 2 fabulous books for anybody interested who wants to read it. There's one book called Excellent Sheep. Yes, it says that our universities are factories, and we're basically training sheep. I'm sorry, guys, I'm a sheep too. You're too. Students, we're all sheeps, and us teachers, we're training sheeps to be excellent sheeps. That's where that meritocracy comes in, that AI will take over if we keep on giving assessments and teaching in a way where we ask our students, okay, what do you understand by GDP? Or what is economic growth? And we don't teach them and we don't assess them on critical thinking, on skills, on creativity. Then we're not preparing them for the job market. How many Jobs are out there. Jobs will increase in number. But what skills are the job market demanding? Are we, especially at the university level, preparing our students for that, assessing them on it? My experiences with the classroom, just to share a story, I've been back 6 months and I've been teaching development economics at the department. And my experience has been, whenever I try to change the assessment and change the pedagogy for the students, they rise up to the occasion. They've never been used to it. We were never used to it. The different types of questions, to think about questions when we write them. We're used to, write the definition of this, write the definition of that. That's what we're used to, that's what they're used to. Whenever I've challenged them, before I went for my PhD or after I've been back, they have risen up to the occasion. So students have that capability. But what are we teachers doing in the classroom to prepare them from that job market? AI is going to take over. If we continue teaching them like this, that they go to the exam and they can just write from the book, then AI is going to take over pretty soon. But what about critical thinking? What about creativity, originality, innovativeness? Where's our next Sharat Chandra? Where's our next Amartya Sen? Are we actually providing an education to create the next Amartya Sen? Are we telling them, think critically? We were never told this, and we're not telling the students that either. I think that needs to change for us to bridge the gap between employment and graduate employment, unemployment and education, and tackle the issue of graduate unemployment, basically. So I just wanted to say that, and the last point I wanted to say in terms of what Tashmin Apu said, that one thing I think a new dilemma for us economists is, so we're going through the era of methodologies, of impact evaluation, RCTs, right? But I really think and believe that us next generation of economists, we really need to focus on studying human behavior, understanding human behavior, so that we can learn to influence it. For example, how do I, in a classroom, or how do I put something in a textbook and make sure that it influences human behavior? If I say, don't litter, am I sure that everybody sitting in this room tomorrow won't litter? If I give you a book that says don't litter, how do we influence human behavior? How do we influence each other to change our behavior? I think that's the new dilemma for us economists, and especially for us education economists and labor economists out there. Because if we don't, robots and AIs are going to take over. Thank you.
Yeah. Thank you so much, Rubaya. Once again, what I hear from Rubaya is that, education has to change ourselves, our inner selves. Like if you're educated and you litter everywhere, you are not educated. So that's it. So education means you have to change your inner self. So kind of know thyself, know yourself. So one thing is very clear from our discussion, whatever we're talking here, is there are severe discrimination existing in the country. So it has been like the the type of education they're getting, or the segmented marginalized group we're talking. Same is true in the case of healthcare, Professor Shimul Bhai. So if you look at the healthcare system in Bangladesh, Professor Shimul, you were speaking in the first place, is that the healthcare infrastructure in Bangladesh, they are not equally well equipped. For example, the healthcare system that you have in Dhaka or Chattogram, apart from them, you don't have any specialized hospital in most of the district, in rural areas. 80% of our doctors, they are based in Dhaka and Chattogram alone. But 65% to 75% of our population, they live in the rural areas. So you can understand how much less access to healthcare they have. So on that note, my question to you, what are the root causes of this disparity in access to quality healthcare, and what policy solutions would ensure healthcare access in a more equitable way across Bangladesh?
Yeah, it's a very tough question, definitely. I don't think there's a quick fix. So let's talk about some country examples we can have. Like if you remember that, just quick recap of what I said before. I kind of mentioned 5 problems we have, and all these actually affect the accessibility, and also the inequality aspect is there, like financing, for example. In the financing part is if your out-of-pocket expenditure is very high, and it become catastrophic, and it become more catastrophic for the poor people than the rich people, because say a cancer treatment costs 7 lakh, 8 lakh taka, just an hypothetical number, and it probably not a big deal for someone who is well off, but it is difficult things to manage that money. So they have to sell their assets. So this is kind of, every part has an inequity aspect. Now, looking at the country example, I kind of try to look at similar to our country, like in Sri Lanka, India. I will not take the example of Singapore. I would love to, but that is not what we can manage. But if Sri Lanka can manage, we can say we can manage, right? And the Sri Lanka has focused a lot on primary healthcare. Their per capita GDP, healthcare expenditure of per capita GDP is also not that good. It's almost 3%. I mean, it's way better than us. But in the global standard, which is called it should be 5%, there is almost 3%. But they're doing very good. Why? They're doing very good because they have a huge investment or focus on primary healthcare, and that the equity part of it. Because the rural area, you get promotions and you get like a lot of the benefit available to the government if you serve in the rural area. In Bangladesh, we have it. I know those who are that in the government job, you have to serve rural area for 2 years before you move to Dhaka or any other areas. But many of us even don't know that they are posted in a, say, Manpura Union or Manpura Upojela Bhola. They actually posted there. They withdraw salary from there, but they are deputed, like they come to Dhaka in deputation or in Borishal in deputation. And it is widespread. And so we keep the system and loopholes in the system that you have to serve for 2 years, and then but you can kind of escape it if you know the trick, if you know someone who is important in policy making. So these are this role has to be strict. And one important is if you want to ensure that rural people, especially to be specific, get the service, you have to ensure physicians there, right? But the problem is, what is the opportunity for them? All the higher studies opportunities in Dhaka, everything. Like you have to do the FCPS, and to be a good doctor, you have to all those trainings, and everything is in Dhaka or Chittagong. And you know that physicians also care about the extra money because they are poorly paid. I mean, physicians probably one of the poorly paid in Bangladesh. So they have to come up with more way to get money, earn money, and that's only ways in serving in that urban area. So these are some quick fixes. How about motivation? We rarely talk about it, right? So someone who is very sincere and work in rural area for 2-3 years, is there any sort of recognition for him? Nothing. So that is totally absent in our public service, not in just healthcare. And we did a study on that was on social protection, though it is funded by World Bank. Few years back, it was for the social workers, and we provided very low-cost intervention. Just best social workers will be named in front of the door, that who is the best social worker, and they're so happy, they're excited that at least my work got recognized. So we don't have that system. So we need to put that in place to kind of motivate, because we talk about always, penalty, force them to be in the rural area, but what is the motivation? Like, again, I come to Sri Lankan example, they kind of get extra incentive if they serve in rural area. So we have to have that sort of mechanisms. And another aspect I want to kind of talk about, I'll kind of finish with that, is preventive. We have to really, really focus on preventive part. And the thing is, if you focus on preventive and in the primary health care, then these people will not go to the secondary and tertiary care. So the cost of healthcare will decline significantly anyway. And there's preventive mechanism that's like Philippines did a very good example. They have a significant increase in taxes on tobacco, alcohol, and all other sin tax. And that has worked tremendously. They're significantly declined cancer prevalence and others. So these are low cost, very inexpensive tools are in place, but we are not applying. So I think with that note, I want to finish because I think we need some time for question and answer. Thank you.
Oh, thank you, Shimul bhai. Right, it's your turn now. You have the floor. raise your hand. I'll pick up one from here, one from here, one from here, one from here in this fashion. So raise your hand, I'll pick someone, and then you just be very brave. So we'll spend around 20 minutes in the question answer session. Yes, go on.
Thank you for the opportunity. I have two questions. I am skipping the third one due to diminishing marginal utility. My first question is regarding the interventions that the non-government organizations have did since our independence for rural development, for development of the marginal community. But their involvement has sparked some skepticism about their role and what they're actually doing, what are their methods, and there are some controversies in the, especially in right-wing community. So how can we address that? How can we clarify the things there? How can we be more transparent regarding these issues? And my second question, I was thinking that well, when the first in the first round you were speaking about the education and the healthcare, but I did not see the child protection. But after that I saw, and it was really moving. My question is around that. The street children that were mentioned, a huge portion of them end up in such orphanages and other institutions which are really religiously patronized, and they are ideologically inclined, and so those places might not be the best suited, as we have had reports of there being abuses in both physically, sexually, and other forms. They are forced to beg, and there are many human rights abuse reports. So is it feasible for us to have state-facilitated and secular institutions that would take care of the marginalized and the street children? Thank you.
Okay, can you have your name?
My name is Muhammad Asim Hossain. I'm from the Department of Economics, University of Dhaka. I'm studying at my first semester.
Okay, so the next question, tell us your name and to whom you are asking your question. So your question is to Rubaya?
My question is to
anyone. Okay, thank you. So can you have the mic here? Yeah. Be very brief. Tell us your name and be very brief.
My name is Mohammad Shahrir Kamal Sadi. I'm currently studying in Department of Economics in University of Dhaka in first year. So my question is to Rubaya ma'am. I heard what you said, and my question is specifically on that point. So there are many schools in our cities, and there are a lot of high school graduates every year. They are coming out. But our learning level and skill sets, these are not up to the mark. So when we are talking about the higher education sector, unlike most developed countries and their education, their admission system, our university admission system is quite different. We study a fixed set of things and get into the university. So do you really think that it's a credible way to measure who is qualified for higher education? And considering that these are the ones who will in the future be the teachers who will guide the nation and the future students. And taking that in consideration, which brings the question that how can we ensure quality education, and should the grading system in primary and secondary level be the benchmark to judge the students' capability and credibility? Thank you, ma'am.
Thank you, Sadi. I will take two more questions. One from here. Can you have in the front? Look at, yeah, good. Yeah, sure. Yep.
Hello, everyone. Thank you so much. I'm Paramita. I'm currently studying in third year, University of Dhaka, Department of Economics. So my question, it kind of combines the two aspects that we're talking about here, education and health. I particularly want to ask about the education of health, like the medical colleges. When we are younger, a lot of our friends write that in essays like, I want to be a doctor in future and I want to go to the village and like help out people. So when they become doctors, when they're in the process is so meticulous and it's so less rewarding. And it also comes down to that return on education, that labor market outcome. So when they're in that process, that goodwill that they had initially, a lot of them lose that goodwill. And by the time that they have passed from their educational institutions and they're pursuing higher education, they are into this very capitalistic mindset that I have to get the return on what I've invested, on my time, on my efforts. So could there be like a better way to psychologically motivate them throughout their educational years so that they don't lose that goodwill? Because it actually depends a lot on that goodwill, because we're a country with really limited resources. We may not be able to push out a lot of doctors that we need or give them as high incentives that we want to. Of course, there's a lot of room for improvement because the investment in health is really low. So there can be policy, but can we focus on keeping that psychological aspect, that goodwill, keep it going and see if that has any returns? Thank you.
Thank you, Paramita. Can we have one from here? Let me check the hands. Can you give it to her? Yep.
I am Najat Afnan, a first-year undergrad student from Department of Economics, University of Dhaka. My question is for both Rubaya ma'am and Tashmina ma'am. Ma'am, as you mentioned meritocracy, what's your opinion on bringing a change on our admission system, focusing more on an infrastructure that favors a holistic process? And on that, our primary education teachers also go through that same meritocratic process. So do you think we need a change on that selection process as well?
Okay, let me take one more question because I thought, yeah, go on. Not you, behind you. Yeah.
Thank you, moderator, and thank you, our distinguished panelists, for this beautiful discussion. My question is to Dr. Rubaya Murshid ma'am. We talked about leisure economy, how it's booming in the last panel, and you also talked about how influencers are earning more than a lecturer now. So my question is, we see that very negatively as a society, but do you think that this would help in positively reframing the purpose of education in the root level in the long run? Thank you.
Thank you so much. Don't be disheartened. I will come back to you for another round. So now I come back to my distinguished panelists. So let me start with Rubaya, because most of the questions, after Rubaya, Tashmina Appa and Shimul Bhai.
Thank you, Matapay. I think the first question was from this young gentleman. The first question was, I think, in terms of quality education. Okay, so in my experience, it all comes down to mentality. I don't have enough evidence to say that that particular group of children are the only group of children who are being abused. Honestly, when I studied the education system, I had a sort of idea that underprivileged children are missing out. But honestly, I discovered that children at all levels, privileged, underprivileged, are missing out because our education system is rubbish. It's all across. In terms of abuse and violence, I think we need to be careful in specifying. It could be, we do see instances of this sort of abuse, and I am not sure what the root of it is. What makes a human be so cruel? I'm not sure whether it's religion. We can call it indoctrination, but it is the absolute most horrible form of cruelty. That brings me back to education and the dilemma that we have as social scientists and economists. It's the hardest job for us. Economists have had it easy so far. The problem for us is difficult because how do we change people's mentalities? How do we influence a teacher to realize intrinsically that no, you cannot put your hand on your student, you cannot abuse your student? How do we intrinsically motivate people that don't marry off your girl? She has a choice. How do we motivate people? Be kind to others, don't be unkind. That's very difficult. How do we change people's mentality? It comes back to human behavior. How do we design mechanisms where we actually influence human behavior? How do we make sure you follow it and they follow it too, I follow it? That's what we need to study. So I don't have a quick fix for that. Every child out there who is being abused, they have my sympathy. But I think as it is our responsibility, I wish we could go and save each of them. That's a short-term solution. We should be able to. We're not being able to. But I think the long-term solution there is understanding what makes human beings monsters. And that's where the role of researchers also come in saying, when do people develop such horrible mentalities? There is no evidence saying that if you're poor, you're abused. There's no evidence saying that, okay, it's because you're of a particular religion. We can't draw those correlations without actually studying the evidence, right? So it comes back down to human mentality and how we influence it. I think there was there's another question in terms of quality education from a young lady down there, a young man down there, sorry. So quality education, how you mentioned learning levels, right? Learning levels. So from my studies of the education system and the different nuances there's the pedagogy, there's the curriculum, there's the assessment system. They go hand in hand, and why in learning levels not being what they are, the failure of the education system. And studies have shown, Esther Duflo has a study on this, and I agree with her when she says it's the tyranny of the curriculum. In Bangladesh, it's not that in some places we hear in our regions that students go to class and don't learn anything because they're not being taught anything. That's an exceptional case. But even in classrooms where things are being taught, but students are not absorbing it. The nuance there is, one thing is there's a tyranny of the curriculum. The curriculum is so broad that students are not learning what they're supposed to learn at the end of the day. There's the pedagogy factor, there's the assessment factor, and then at the end of it all, it's something that Ashwin Apu mentioned, it's the one-size-fits-all approach. In our classroom, do we actually target the child who has fallen behind? Teaching at the right level is Pratham's brainchild, where they actually go into a classroom and they use tools to identify, okay, you're behind, you're a bit ahead, but we're going to cater to each of you in an individualized way. Now, as economists, we have to think there's a trade-off there. When we focus on that quality, quantity becomes an issue. Do we provide a generalized one-size-fits-all lecture where, when I deliver a lecture in the classroom, I have 150 students. I'm not always able to focus on everybody's individual levels. It has to be a generalized lecture. Think of that in every classroom around the country, at primary, secondary, higher secondary, university level. That's where we bring in tools, we bring in innovation. EdTech is something that's being researched now, that how can we use that to teach at the right level. In terms of learning levels, that's, I think, where we're heading. It's about the curriculum, streamlining it. It's also about catering to each child. And then understanding who is falling behind, who is more likely to fall behind, who is not reaching the learning levels.
Sorry to cut you short, if you could finish in a minute.
Oh, yeah, sorry. Okay, next question, mentality, education goals. My student out there, the question was about the medical college system, goodwill. Comes back to mentality in short. If I have a goodwill, the system, I agree with you, it's established in a way and it runs in a way that it wants to kill your goodwill. It's trying to kill my goodwill after I've come back. But how do I hold on to that goodwill? It's a very person-specific thing. That's where each of our drives, each of our mentalities come in. In a system, it's not supposed to be so person-specific. The system should encourage us in itself. It doesn't. But that's where mentality comes in. And how do we bring in these as mechanisms, as a system, as an institutionalization? How do we institutionalize goodwill and mentality so that we motivate each other, right? And then the last question, leisure economy. I'm not looking down on influencers. I respect them. They can earn 3 times more than me. I don't mind. Good for them. My point was that if the next generation comes along and says, we don't need to go to school, if you're telling us that you're sending us to education to earn, to get a job, I can already get a job now. Why do I need to go to school? That's why I mentioned that influencer thing. It has its positive sides as well. Entrepreneurship, innovative thinking, children bringing up their own businesses, their own videos, influencing. It's a fabulous thing, but it cannot substitute education, but it will substitute education if we keep framing education as the path to the labor market. If education has a more comprehensive goal of making human beings, and not just human capital, but making human beings kind human beings, civically engaged human beings, responsible citizens, then we won't have that problem. But if we only want human capital, then our children will come to us tomorrow and say, we don't need education, we're already human capital.
Thank
That
you so much.
was my
Rubai.
point. Thank you.
Thank you. Can you have Tashmi Apu, if you have anything to add in 1 or 2 minutes, please?
Yeah, so there was one question regarding primary teachers recruitment. So again, on this, just to mention that at one point, we did reduce the qualifications for female teachers to get into primary government schools. And the reason behind that was there were a lack of female teachers, and the thinking was that having more female teachers meant more enrollment of girls and ensuring their retention. And that did work in our favor. But after a decade or so, what have we seen? We've seen that these teachers weren't equipped enough. There's no pre-service training. After they join service, they receive once or twice a very short training, and then that's it. So, there are a lot of countries that are struggling with this issue, and again, it comes to the flow and stock. So when we consider the flow, these are the incoming teachers. So do we make the process more competitive? Do we look at the broader issues where we want to make sure that people who are interested in becoming teachers are the ones that we are getting? And for that, yes, we can make changes in the teacher recruitment rules and regulations. But then again, we have this huge stock of teachers. So what do we do with them? And I think that this is actually a reform area that I understand that's being worked on. And we really have to look into our teacher recruitment guidelines as well as teachers' professional development for those who are already existing in the system. A very quick touch on the NGO issue that was brought up by a gentleman here. So I will just have to say that, when the government is not providing services or is unable to provide services in certain areas or to certain communities, the non-government organizations, and even in some cases private sectors, have a huge role to play. It opens up a space for them to come in and contribute. And there are areas where they have actually brought in innovative programs. For example, their work in early childhood education, in fertility, awareness issues. The NGO have had great success, and they brought in interventions that were later scaled up by the government. And so I would say that the NGOs and private sector have an important role to play, but I take note of the issue that you mentioned, and for that I think accountability and transparency mechanisms are extremely important. And very simple things, for example, as communities in which that work is being done, just providing them information that, do you know that this program is being undertaken in your community? This is what are the services you are expected to receive. Making sure there's open data or access to that information, even if it's on a board somewhere where people can read and know their rights and what's being done. There's grievance redress mechanisms for people to complain if they are not receiving those benefits. Those come a long way, and I think this is an area where we have more scope to work. Thank you.
Thank you, Appa. Shimul Bhai, if you have anything to add in 1 or 2 minutes.
Yeah, just 1 minute. So the goodwill part I want to address is, in our childhood, many of us has written they want to be doctor and want to serve the rural people, right? This is the aim in life. But that kind of flipped. We don't want to go to the rural area, and we don't like to serve the rural people. The one issue is here, it's called, there's a one big sociologist, famous sociologist said, there's called culture of profession. Every profession has some culture. Like an economist, we care about numbers, measurement, equation, modeling. So, and social anthropologists, they don't believe numbers. They want to go to people and listen to them. So every discipline has some culture. And in medical education, we don't put enough emphasis on ethical part, sociological part, because medical science is not science, it's an arts. Why you call it someone good doctor? Everybody should be trained same way. So what is good doctor? There's the art part of it. So we kind of ignored that art part, and also we don't have celebrated doctors who provided service to the poor people. We have celebrated doctors who have tons of patients. So this is kind of thing need to change and motivate them, awarding or some level of motivation those who are creating good examples. I think that little low-cost interventions are in place. We can definitely design if we kind of see other countries' example. Yeah.
Thank you, Shimul Bhai. So I will come back to the audience. So again, I will take 3 or 4 questions now.
There was a
Now,
question regarding the NGO one.
next time after during the dinner, please. So can I have some hands? Yeah, can we go to that in the back? You can have the discussions. We have 1 hour for dinner. Okay.
Hello everyone, my name is Tausif. I'm a second year student at Institute of Health Economics, University of Dhaka. As we know, Bangladesh out-of-pocket expenditure is one of the highest in the globally, exceeding 74%. How can Bangladesh reduce this out-of-pocket expenditure without relying on health insurance? As we can clearly see, some programs like Shastro Surukha Karmoshuchi haven't gained that much widespread acceptance.
Very good question. Now a question from this side. Yeah, go on.
Hello, Assalamu alaikum, sir. My question to Shashun Simul, sir, who is also my direct teacher. I'm a graduate from Health Economics, University of Dhaka. So my question is to Shimul, sir. I saw a news today. It says about 10,000 people from 327 NGOs have been laid off due to stoppage of USAID funding. And mostly education, environment, and healthcare sector are tormented the most. So, and I also see that about the operation plan of 5 years has been reduced to 2 years. So, what should government do now, and what is your suggestion to this? Thanks.
Thank you so much. Now, one question. Can you have him? He has been waiting for so long.
Thank you so much. So my question is to Tashmina ma'am. I'll keep it short. I'll just ask her a question. So it's about that learning poverty indicator that you talked about. Does that account for learning disabilities like dyslexia and things like that? And how will we make sure the people who have learning disabilities, they don't fall behind? That's my question.
I'm so thankful for you to raise this question. Very important one. One question from there, please. Yep. Your name and
hello everyone. My name is Shafkat Shafiq. I'm currently a student of Institute of Health Economics at the University of Dhaka. So I will have a very short question and one-line answer from the guest. So my first question will be to Tashmima ma'am about is it possible to ever create an equitable education system without creating a one model system for, that means education system for all. There wouldn't be any divided of English version, Bangla version, English medium, madrasa or whatever, or what are the different criteria. And my second question to Shimul sir, you have given some short-term interventions or short-term key solutions that we could achieve at this moment, like following, focusing more on the primary healthcare. But my question is, what do you see in the long run? What model or in which position Bangladesh should go? Is it be in a complete social security system like Thailand or South Korea or Indonesia, or focusing on Sri Lanka, or a completely nationalized based healthcare system where everyone will achieve a more equitable solution? That's all. Thank you.
Thank you, Shafkat. If there's any more pressing question, I can take one more. Yep. Be very quick, okay? Your name and be very quick with the question.
Thank you for giving me the opportunity. Good evening, everyone. This is Saimuddin Shishir from Jahangirnagar University. I'm a third-year economics student. Actually, my question is about the previous asker was asking a question about the curriculum or about the different curriculum system. Here, I have an insight that the double standards civil society sometimes talk about that diversification is important. And I think to ensure this diversification, variety in curriculum is important. So how can you deny the variety in curriculum? Whenever you are denying the variety in curriculum, how can you recognize the Chakmas language? How can you recognize, if you want to learn English in a better way, you need the English medium. So this is the additional part to his question. And I'd like to share two aspects. One is about the BCS and social thought process, which is something like that everyone was talking about, that there are small job market, less options, so we have to choose the BCS. I think apart from that, there are another things or social aspect, something like that আমার গার্লফ্রেন্ডের বাবা তার সাথে আমার বিয়েতে রাজি হবে না কারণ আমি বিশেষ ক্যাডার না। তো এইরকম হচ্ছে প্রবলেম আমাদের সোসাইটিতে এক্সিস্ট করে। আমার ফ্যামিলি আমাকে এখনই প্রেশারাইজ করা শুরু করছে যে সরকারি চাকরির জন্য প্রিপারেশন নেওয়া শুরু করো, কিন্তু আমার ওইদিকে কোনো ধরনের মানে যাওয়ার ইচ্ছা নাই। তো এই যে প্রবলেমগুলো এগুলোও কিন্তু আছে। এরপরে and there are another I would like to share, which is quality education everyone was talking about. And I'd like to share this aspect from the point of view of appointment of teachers, especially in the university, where we see that this system is somehow corrupted. There are, whenever the teacher are appointed, the process is something like that. The recruiter, seek for that which political party this student is aligned with, or how much CGPA this particular student holds. Actually, is it ensure the quality education? And that's all.
Thank you so much. We didn't get any female voice in this round. Is there any female students or colleagues who want to raise a question? Can you have the mic there, please? Thank you. Yep.
Hello, I'm Naznia, an undergraduate student in health economics at Dhaka University. World Health Organization recommends allocating 5% of the budget to healthcare, but Bangladesh provides only around 1%. What political and economic barriers prevent higher investment?
Thank you so much, Nazia. So I think we have very short time now. I can't give you more than 2 minutes each. So if you can just address the question very briefly.
Sure.
Thank you.
So I'll take the one learning system for all question first. So thank you for that. Personally, I think, and when someone had already alluded to that, is people should have the right to choose the kind of education they want, and it's more or less to do with how diverse population of Bangladesh is, right? But I think it's the basic right of everyone to ensure that regardless of which education stream or that they study in, that they all are able to access good jobs, have healthy lives. And from that perspective, I had mentioned a bit about national qualification frameworks, which ensure that regardless of which stream you come in, there's your qualifications are considered as one unified unit that signals to the job market. And it also allows you to move from one stream to another because there's an alignment in qualifications. And I think we really need to, it kind of addresses the unified education system outcomes while also allowing people to choose what streams they want to based on their preferences. On the learning poverty definition, unfortunately, we don't consider children with disabilities or students with disabilities. It considers out-of-school children and then learning levels or learning competencies in the indicator. But I do hope at one point we can. And I really want to thank the person who brought up the inclusive education aspect, which we haven't actually discussed. I'm now thinking about it. Even we haven't brought it up in our discussion. And I think it's kind of a reflection of our national dialogue as well. Unfortunately, there is no survey or census on the number of children with disabilities. We were not able to conduct that over several years, and we don't even have that basic information. So there's still a lot to do in this area, but there are some promising initiatives that have been taken up by the government, especially with skills trainings, where we're working with private sector in delivering these very tailored programs. So thank you.
Rubaya.
I don't think I had any questions this round, but just to touch on the unified system, I have a lot of work there from my MPhil. School choice is actually good for society. If both of you, the second person actually answered the question of the first person, if you go into the school choice literature, having different choices of this type of schooling you want to pursue actually there's evidence showing that it drives up the quality of education all around. So that's in terms of that. And in terms of inclusive education, thank you to my student there for bringing that up. And I think two things we missed in our discussion. It's not possible to cover so many things. It's one in terms of disabilities and inclusive education in terms of that. And another is mental health, especially after this amazing July uprising. I think it is very, very important. It has always been important to provide mental health support to our students and teachers. And that is missing in our dialogue and in our narrative as well. Thank you.
Thank you. Shimul Bhai?
Yeah, yes, I'll keep 2 minutes. Okay, so lots of question. Out-of-pocket, reducing out-of-pocket expenditure. The main causes of this out-of-pocket expenditure is almost 64% of that out-of-pocket expenditure is from drug. So we have to improve on that, rational use of drugs. So there's many policies you can adopt. And there is an example from Cambodia. There's their per capita GDP is almost half of us. They have a health equity fund. That fund actually help poor people to get all services from the facility when needed. So, and that we can do. And also, one thing I want to kind of say I would recommend, for example, we have corporate hospitals, private hospitals. They don't have any corporate social responsibility. They should keep 1 to 3% of their total patients that they will get free of cost. Why not? They can do it, they can manage it. So that would significantly reduce out-of-pocket expenditure in the short term. One other question was about USAID and OP. I will not go with that. That's kind of more international issues, very difficult to answer in few seconds. We need to find all other funding. That's probably the answer, a shortcut. Long-term model, other than primary care, it's very tough question. I will not answer broadly. We probably there is no single system will work for us. We need to kind of combine multiple systems, and there's a way to do it. Why our expenditure is 5%, less than 5%, the political part of it, because our leaders never care about health. They care more about infrastructure than health. So because the health improvement is not visible quickly. If you invest now, you get a return after 20 years, and by the time you are not in power. So why should I spend? So unless we have a demand, significant demand from our side, there will be no increase.
Thank you, Shimul Bhai. We are almost towards the end. Let me tell one thing is that, do you know, when I was in the school, যখন স্কুলে ছিলাম, আমার সবচেয়ে বেশি টর্চারিং মোমেন্ট কোনটা ছিল জানেন? সেটা ছিল হচ্ছে স্কুলে ঘন্টা পড়ার আগের, ছুটির ঘন্টা পড়ার আগের 10-15 মিনিট। ওই 10-15 মিনিট কোনোভাবেই কাটতো না। So I can see in your face actually what torture you're going through. But the discussion we had today, it was so engaging. I'm really grateful to my panelists, Tashmina Appa, Rubaiya, and Shimul Bhai. We have touched down on so many issues, but remember that, as Rubaiya was saying, Tashmina Appa and Shimul Bhai was saying, we could not touch up so many things. We missed out the mental health issue. We missed out the issue on children with disabilities. And there are so many things that we need to discuss more and more. So this discussion should be carried on a regular basis in all fronts, academia, policy dialogues, and with the discussions between the NGOs, INGOs, and the civil society organizations. With that note, let me end this session. You are free to go and enjoy your dinner. Have a good night. Take care.